Now, I want to digress into psychology a little bit and buttress on the things that the first speaker and the favor said. When it comes to psychology, you can be so exposed to something that you begin to believe, I don't know if you understand, that thing is you or you have that thing. For example, growing up, you were so exposed to men as scum. You heard it from your mom, heard it from your aunt. You can see your other friends, female friends on social media saying men are scum. And you grow up to begin to observe that men might actually be scum. But if I tell you that you actually produce that reality by believing what you heard, would you agree with me? The same way there are some beliefs men have about women. They heard from their dads, heard from their uncles, their brothers, and as they grew up, they began to see those things being actualized in women. It's actually you that created those things in them. Because when you believe something, you begin to create the possibility for that thing happening to you. So when it comes to PCOS, it's good that we all go and get checked. But up until you get checked, you begin to observe, okay, I think this is why I've been growing fat. This might be why I have been observing this, observing that. If you're not sure, don't begin to drown that you might have PCOS. Do you understand? Until you check all the boxes, do not begin to drown, okay? You might have the symptoms but not have PCOS. I don't know if you're here with me. Do you understand?
Yes.
So don't let your psychology play a trick on you, thinking you have it but you don't have it yet. So do the proper thing by going for a checkup before you begin to judge yourself for having PCOS. Okay, so based on personal hygiene, we have lots of activities like cleaning of the body, which is, first of all, washing of your hands, bathing properly. You're supposed to bathe 2 times a day. I believe you've been told that, first thing in the morning, last thing before you go to bed. But actually, once you step out to people, you go to class, you go to the market, you come back, before you bring all those things and lay on your bed or change into new fresh clothes, you're actually supposed to go and take a bath. So it's not just morning and night. Every time you come in contact with anything whatsoever that might have exposed you to pathogens, might have exposed you to bacteria and all of that, it's always advisable that you take your bath. You wash your hand at every point in time. Before eating, after eating. For medical professionals, between patients, always wash your hand at every chance you get. You just shook someone, wash your hand. You just sneeze, wash your hand. And you know, sneezing into your palm is not the ideal way to sneeze. You're supposed to sneeze into your elbow. Why? Because you can sneeze into your palm and just quickly shake someone, or use your pen and then pass that pen on to someone else who will begin to chew on the cover. So it's always advisable that you wash your hand at every point in time with every chance you get. The next thing we have is your oral hygiene. Some of you don't brush at all. So brush only once a day. And then when you want to talk to someone, they can't reply you because they want to breathe. Brushing is very, very important. And also flossing. Because when you brush, your brush might not be able to go in between your teeth. It's always advisable that you floss. Wash your tongue properly. First thing in the morning when you wake up, after you slept, and then before you go to bed, after you're done eating, you remove all the cavities and all the food particles and everything in your mouth. And from time to time, go to visit the dentist. Just check what is there. Remove the cavities that are there. Go to flush and clean your mouth from time to time. And reduce your intake of sweets. You're always taking sweets. It can lead to your tooth beginning to decay. And also, for those of you who know how to self-medicate, you begin to feel something antibiotic, begin to feel something, you're popping pills or you're taking this, you're taking that. Antibiotic has an effect on the teeth. It can cause your teeth to begin to decay and to begin to lose its original form. You see brown tooth, you see your tooth begin to disfigure itself and all of that. So self-medicating is also a form of bad hygiene. If you observe anything in your body that you don't really resonate with, you don't really understand, it's advisable that you go for proper checkup and you go to the right medical personnel for that. Now, grooming. A lot of we ladies like to keep our nails long. It's beautiful, it's nice, but as a medical personnel, you're not supposed to keep your nails long. Try for nurses that are always walking around the floor. Germs can hide beneath your nails, and you carry it home and use the same nails to eat them back. Some of you, when you can access cutlery, you use your hands to eat, and you don't even wash it properly, wash your nails properly. So instead of carrying germs up and down, it's advisable that you cut your nails, trim them. Then next we have the respiratory hygiene, that is covering your nose and your mouth, blowing into your elbow when you want to cough or when you want to sneeze, and all of that. And now for disease prevention, face masks wasn't just for COVID-19. You're having cough, you don't want to infect someone, face masks. Sometimes you're sweeping dusty environments, wear your face mask. Don't know if you understand. It's always important that you're always protecting yourself at every point in time. You're going to a place you're not setting off, wear your face mask. Summertime period that is always carrying dust up and down, you can decide to wear your face mask. It's not just for COVID-19 period, it's also for keeping yourself safe and for ensuring that your hygiene is always being maintained. Now, what are the benefits of personal hygiene? First impression is always very important. The first time you meet a person and they are smelling, or they talk to you and the aura is saying something else, you always register that thing in your head. Even if the next time you see them, they are probably neat or more organized, that first impression has just spoken of who they are. Sometimes you just, maybe you want to go for a casual walk and you dress anyhow, and then you meet someone you're not supposed to meet on that particular day. It's advisable that you ensure that you're always maintaining your personal hygiene, whether somebody's watching or not, whether you're having expectations or not, because first impression is always very, very important. You don't know who you meet, you don't know who you speak to, you don't know who is keeping tabs on you. So that first impression of appearing neat, your hair is well groomed, your nails are well cut, you're smelling nice, you speak and someone can breathe and reply you properly, is always very, very important. So that's one of the major importance of personal hygiene, first impression. Now, increase approachability. Whenever you go to a conference, you attend a program, you are more likely to gravitate towards a person that is looking neat and kept, a person that is looking presentable, a person that is well dressed, a person whose hair is neat. You're more likely to approach that person than to approach a person that is looking disorganized, disoriented, smelly, anyhow. So people approach you more when you look presentable. People approach you more when you smell nice, when you talk properly, when you look okay. And personal hygiene, beyond how you appear, also how you speak. You're so fine and then you open your mouth and you're saying is and was. You're mixing words, speaking upside down, speaking in and outside. So when you appear properly, you speak properly, you smell properly, all this together increases how people approach you properly. Now, one more thing about personal hygiene is that it reduces stigma and isolation and boosts your self-esteem. Those of you that are struggling from low self-esteem or you have inferiority complex, if you begin to dress better, begin to smell better, begin to take your health and your personal hygiene seriously, it actually helps to boost your confidence, it helps to boost your self-esteem, and it helps you make you feel better about yourself. Now, constant checkups are very, very important. Always go to your hospital for checkup. I remember I told them the 400 level that they must have pap smears done, they must have ultrasound done. These are things you should do once you're of the age of being sexually active. Constantly go for checkups. Don't keep popping antibiotics or antifungals or anti-inflammatory or any of those. Ensure you're going for checkup. Go and check on your full blood count, your complete blood count, your platelets level. Do consistent checkups to ensure that you're always okay and your body is always sound. Now, we know checkups are very, very expensive. I mean, you want to do this test, you're hearing 20K, you're hearing 50K. You might be like, I'm still a student. Now, when you know you cannot constantly check up medically, check yourself. What you eat, how you eat, when you eat. Observe when your body is giving you signals of I'm stressed. When your body is giving you signals of this is not how we normally are. Your period is awfully heavier than normal. Your period has skipped its normal days. You're beginning to feel heaviness in your breast. You observe any form of abnormality in your body. You're checking yourself up. You're beginning to be aware. Don't know if you're understanding. Exactly. So when you know you cannot keep going to the hospital every single time, be observing yourself. When you notice something that is not normal, something that is not the way it's supposed to be, then you should go for a checkup. You should go and check yourself up, go and get a medical advice and be sure that it's not a symptom of something bigger. Now let's move to HPV. I said HPV means human papilloma virus. and human because it affects the human beings. Papillomas are like, what do they call them? Warts. How many of you know what warts are? Warts. 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 They usually appear on the skin, sometimes on the genital, like small balls put together in one region. Sometimes they can be dark. We call them warts. So papillomas are like warts, and virus obviously causes a viral infection. Now, the funny thing about cervical cancer caused by HPV is that